things. We do have some really good medications that are on the market now. Zepbound and Wegovy. So I'm going to tell you a little bit about those. The first ones to kind of, well, not the first ones, but the ones you're probably most familiar with, Trulicity, Ozempic, and Mounjaro. These medications were developed for patients with type 2 diabetes. What they found is that those medications were very successful in losing weight. And so the patients who had overweight and obesity, but did not have type 2 diabetes, were not able to get those medications because they didn't have a diagnosis of type 2 diabetes. So their insurances would not pay for Ozempic and Mounjaro or Trulicity. So the people that had overweight and obesity were upset that they were not able to get these medications that were so effective in helping patients lose weight. And these are in the category of they're called GLP-1 receptor agonists. I'll tell you about that in a minute. And so what the FDA did is then approve these medications for people that had overweight and obesity. So Zepbound, if you have obesity and you have type 2 diabetes, you need to have both, then you get Mounjaro. If you have obesity and you do not have a diagnosis of type 2 diabetes, then you get Zepbound. Both of those, Mounjaro and Zepbound, are called tirzepatide. These medications, these GLP-1 receptor agonists, they do several things. They block the receptors in your body that convert the food that you're eating to glucose. And so what happens, instead of those excess calories getting into your bloodstream and you can't use them and they're just stored as fat, it keeps it within the GI tract and you just end up pooping it out. It also slows down the gut. It reduces what's called peristalsis. Your GI tract from your mouth all the way to your anus move kind of like if you were milking a cow. Your entire GI tract does that to move food, even when you're not eating. You've got saliva and sloughing cells. It moves that through that system, and these medications slow that process down. Therefore, when you do start eating, you get full faster, and then you stop eating sooner because you're full with a lot less food. The next thing that it does is it reduces that food noise. We call it food noise in your head. That goes back to kind of my conversation with the addiction, is that oftentimes people start eating when they're not hungry because they're thinking about food. They're thinking about the next time they're going to eat, what they're going to eat, what's in the pantry. That's called food noise. These medications have been fairly effective at taking the food noise away. So instead of thinking about food all day long, you're thinking about everything else that you have to do that day. And hence, that's another way that then you're starting to reduce calories. So these are fantastic medications to help people lose weight. It is an injectable. It's a once a week injection. We train people how to use these medications. It's not that hard. Although the drawback here is they are extremely expensive. They are designer medications, especially in the United States. And the insurances now are getting fairly fussy about who they are going to approve and cover. They are requiring us to fill out prior authorizations, which is taking your healthcare providers a very long time to do. And then half the time they get denied anyway. So there are some pros and cons to these, but it might be something that you want to talk to your provider about. You might want to call your healthcare insurance to find out if they cover it and then what the requirements are. Many of these insurances will require a patient to have a BMI greater than 30. So they're not covering it for the obesity. For the overweight category. They're only covering it for the obesity category. So a couple of things there. And then some of the insurances, depending on what insurance you have, they will pay half or they won't pay any of it. So it's a little bit difficult to get these, but I just wanted you to know that that's there. This is Wegovy. This is called semaglutide. That's the chemical name for it. This is equivalent to Ozempic. I'm sure you've probably seen these advertised on TV. This is one of the GLP-1s. And with these medications, they come in a stair-stepped fashion because they can have side effects, because they will reduce the peristalsis, they slow down the gut, they will often and almost every time have side effects, including burping, bloating, nausea, vomiting, constipation, diarrhea, or any combination thereof. Some patients have no side effects whatsoever, and other patients have fairly significant side effects. So we always start these medications at the lowest dose. We keep a patient on that dose for 4 weeks, and then we stair step up. And you can see here, they all have different dosing, but Wegovy, you can see here, you would start a patient out at 0.25 milligrams, zero point 0.5 milligrams, 1.7, and then it ends at 2.4 milligrams. And it's a once a week injection. You inject it into the, I recommend the abdominal fat. The websites say that you can do your arms or your thighs, but the fat that is in your abdomen is more metabolically active. And I think it tends to work better if patients inject it in the stomach. So these are Wegovy, and then both Zepbound that I'm going to talk about next are fantastic weight loss medications, and something else you can discuss with your provider.